Tomorrow, I plan on raising what's happening in nursing homes and long-term care facilities with the premiers during our weekly call. I will once again offer our government's support as they try to get the situation under control. As I've said many times, we need to do a better job of caring for seniors. They raised us, they built this country, they deserve better. I think obviously we need to make sure that in Canada there is a better job of supporting our seniors, particularly in long-term care centres. That's why we are there to help, and we've offered to help with the provinces. We will, of course, always respect provincial jurisdictions, but we will be part of those conversations. In the immediate, we need to make sure that help is improving, that help is getting to people who need it and to centres who need it. That's why we're there with the military and why we're looking at other ways of helping in the short term as well. But for the longer term conversations, well, those need to be had, because coming out of this pandemic and into the future, we need to make sure we're doing a better job of supporting our seniors, and the federal government is there to work with the provinces while respecting their jurisdiction. I think right now, while we're in this crisis, our responsibility is to respond to this crisis as best we can and to ensure that we are improving in the COVID context care as best we can. But absolutely, we need to have conversations about how we care for our elders in this country, right across the country, and respecting provincial jurisdiction, respecting that there are areas that have greater success and fewer problems than others, means that we will need to be very careful and very grounded in the facts on the ground as we look to moving forward. I was able to read the report last night in its entirety in regards to Quebec. Obviously, there are many things that were troubling that highlighted the very need that we had to send in our armed forces to help, whether it was lack of personnel or difficulty in following the strict separation and isolation and PPE rules. There was a need for our Canadian Armed Forces, and it certainly filled me with a tremendous amount of pride and even deeper respect for the professionals in our armed forces who have made such a positive difference in a short amount of time in some systems that were really in need of extra assistance. Obviously, there are difficult things that we need to continue on, but we've seen significant improvement in many of those centres, and there continues to be a need for us to work together, and I certainly spoke about that this morning with Premier Legault in our conversation. Well, the immediate plan is to help out immediately. That's what we're doing with the military. That's why we're working very closely with the provinces on looking at how we can ensure that they have the resources needed to get these care centres properly serving the elders who they care for. There are many things that we need to work on right now. But of course, there will be many important discussions going forward on how we establish a better system in Canada. And I'm not going to, short-circuit that conversation by putting forward aggressive proposals right now. But all I will say is the federal government is there to support and to work with provinces to ensure that in areas of their jurisdiction, they are able to give Canadians the care that they and their families expect. Obviously, the report highlights a number of preoccupying issues, and the military has acted with tremendous professionalism, not just in writing a report and sharing it, but on acting on the ground with administration of the centres, with partners to ensure that procedures are improved. We are extraordinarily lucky to have the amazing professionals in the military who are helping out and protecting Canadians, but this is what they do. They take risks and they keep Canadians safe, and we are lucky to have them.
And what specifically will the federal government do to support the provinces in overhauling the system, ensuring proper staffing and accountability to stop this from happening in the future?
Obviously, we need to do things right now, and we are doing things now to ensure that elders across the country get the care they need in this COVID crisis. But there will be a need for much longer conversations about how we move forward, and we ensure that right across the country, all of our elders who contributed so much, who built this country, get the proper care that they so richly deserve. Okay. I think we know that we need to work together to move forward and ensure that our elders are getting the proper care. But the situation does vary across the country from region to region, from province to province, and we respect the provincial responsibility to get these situations under control. But like I said, we will be there to help in ways that we're needed to do. If there is a need for greater federal leadership, we will certainly respond to those requests. At the same time, everything is on the table as we move forward. We know Canadians expect us to do better by our elders, all of us, and all orders of government, and we will ensure that we do. We've already increased the Canada Health transfers. We transferred $500 million to the provinces at the beginning of this pandemic to help out with the extra costs we knew that were coming. Our focus right now is on making sure that we're doing everything we can right now to help during this particular situation. But of course, going forward, Canadians want to see us doing better by our elders right across the country, even beyond this pandemic, and we're going to be there to work with the provinces on the right way to move forward. I think we definitely need to see situations improved. As we saw in the Quebec report, there are significant improvements over the past weeks in those situations, and in a number of them, the military is ready to pull out or move on from those particular instances. I think the discussions that we're having with the provinces right now is really about how we will move beyond the need for military support, how they will get their systems back under control without a need for federal intervention of having soldiers in our seniors' care centres. We are happy to be there, and it is extremely important, obviously, that we be there during this crisis. But it's not a long-term solution, and we need to make sure that we're working carefully with the provinces to ensure that they are able to solve for this problem for the medium and long term, and we will work with them on that. It's a question of making sure that our elders are well taken care of right across the country. This is something that matters deeply to Canadians, and it's something that we will ensure that happens. We're working with the provinces right now on making sure they have the resources necessary to serve our seniors in the right way. But of course, as we move forward, we will need to continue talking about this and figure out more longer-term solutions.